So patients come in on the day of their surgery. Surgery lasts about an hour, and about 2 hours after their operation, we normally get patients up for a walk. At that point, we'll give them some lunch, and the next day, patients will normally be able to climb the stairs and then go home, often under their own steam or in a car. And over the first 2 weeks, they should expect to see quite a rapid improvement to the point that most patients, by the time they get to 2 weeks, can walk very well around their houses without any support, with minimal pain. And at that point, most patients can return to driving. Over about the next 4 or 5 weeks, your hip will get better and better. And patients will find that they get to a stage where they're about 90% recovered. And at this point, they're seeing their lives coming back. They're returning to work. They're able to do some of the things they enjoy. And then over the next 3 or 4 months, that final 10% of improvement comes. Hips just get better and better. And at the end of the day, you should get to a stage where you've forgotten you've even had the surgery and you just lead a normal life. And that's the object of the surgery, is to give you a forgotten hip. When you have hip replacement surgery, there's a very careful assessment process where we look at your individual needs, and in particular your medical issues, and make sure that you're fit and healthy for the surgery. In general, it's always a good idea to keep yourself active, which keeps your muscles strong. Try and cut down on things like smoking if you can, and to optimize your weight. But in general, the most important thing is to stay active and plan your surgery in a way that it suits you the best, and that way you'll get the best outcome. Hip replacements are a very safe and reliable operation, with nearly 98% of patients having a good or excellent outcome. In spite of that, there are some small risks which you need to consider before having surgery. Fortunately, infection is incredibly rare, as is changes in your leg length or your hip popping out of place. We take great care to make sure that you don't get any blood clots, and we'll be giving you some blood thinners after the surgery. You should expect to get through the surgery without any problems, but you should always bear in mind that there is a small chance of a risk when you agree to have surgery. Over the years, we've worked out which hip replacements work the best, and we can now confidently say that most hip replacements will last patients 25 to 30 years. It used to be the main cause was wearing out of hip replacements when they failed, but nowadays it's other factors, such as people falling out of trees and breaking their leg. So hip replacements now, for most patients, will last them the rest of their lives.